Hello people, in this video let us look at how to read physiology. Okay, so basically physiology is something normal that happens in the body, right? So it is not like pathology where you're reading disease state. So it is comparatively easier. It is a normal thing that happens in the body. Now physiology, basically in the previous videos we have already covered the textbooks and the syllabus. So you have looked at those videos hopefully. So now just how to approach the subject and how to read it. First of all, the thing is you get such type of question banks, okay, of the previous examination papers. Go through those question banks, okay. Prioritize, see the priority of questions, what type of questions they are asking. Focus on the topics, okay. Focus on those priority topics. Don't focus and read everything. You should know what is priority, right? You should know what the priority is. So, hopefully for you also the pattern will be same, where you'll have a paper 1 and paper 2, where paper 1 covers certain parts of physiology and paper 2 covers certain parts of physiology. So first point you got that you have to read the question bank and get the priority questions. Okay. Now let us say that a priority question is something like visual pathway. Okay. Now where is visual pathway? So basically what you should know is you have to draw the diagram, practice it many times, okay. So when you draw diagrams, that is how you study. You're studying with a book in your hand, scribbling in that book, the diagrams you will scribble. Then you get the pathways. For everything there is a diagram. Show me a question in physiology where you're not drawing a diagram. Let us see. We'll just look at some, okay, muscle physiology, nerve muscle. What exactly is this? Some synapses, okay, some of them don't have diagrams. Enjoy life, so some of them don't have diagrams, not like anatomy. Okay, fine. So you have to learn the physiology. So basically physiology you can know step by step, what happens, what comes next. That is the kind of approach to physiology, okay. So make your notes, revise them, right? Always have a pattern, right? Like let us say proximal convoluted tubule, always have a pattern, right, where you are saying that this is the lumen, so you should know how the urine is flowing, these are the luminal cells, this is the blood. So you should know that, wait, I have an image in my mind and that image itself will flash in the exam and you will write it, okay. And always keep this image as a reference. Even future when you go to pathology, use this diagram only, okay. Your notes, it will sit in your head. Left side something is there, right side something is there. Yes, I know. Same images you should continue to use. Don't change the images, okay. Make your image, make your notes. Let us look at some practical things here. What and all they will ask. Physiology practicals is very difficult, guys. Basically, you will have some experiments, right? You'll have clinical experiments, human experiments, examination of the respiratory system, examination of the cardiovascular system. These are not very easy. Before your practical exams, please look at some videos which are available online and know you have to stand at the right side of the patient. What should the angle of the patient be? Should he be sitting? Should he be standing? Right? Physiology, physiology lab, whenever they give you repetition, go attend it. Okay, so that is another suggestion here, that you will have to practice the experiments, right? Very, very important. You should know the technique. Especially when vision you're checking, right? When you're checking vision, let us see special senses here. When you're doing this kind of perimetry and all that, very important, you should know the position of the eye, and what else? Visual acuity if you're checking, how to check visual acuity, right? Hematology, guys, basically you'll have to prick yourself, get a drop of blood, right? And you know your blood group, so it should not be difficult for you to do blood group. You will know your approximate hemoglobin. However, that doesn't matter. You do it thinking that it is a patient's blood. You do the accurate analysis, okay? Count the correct number of WBCs, correct number of RBCs. You do your own analysis, okay? And when you're doing smear, when you're getting a smear, be very careful in making the smear. If required, make 5 smears also. Choose the best one if there is time, if the college is giving you enough number of slides. So it should not be difficult, because remember, again you will need to do all this on somebody else's blood and pathology, right, later. So on your blood it should be fine. You should be able to know that it is normal. If you are normal, you will know that you will get normal counts, right? What about viva? See, Viva basically is so vast, right? But they should actually, the examiners should focus on the high priority topics again. I got a sadist examiner. We actually, our batch got sadist examiner. That's what we felt. However, yours may not be so bad. So, always remember that it is easier at physiology level. When it goes to pathology, etc., it becomes much hard. Okay. So, that's all about physiology, guys. Just remember that you have to read the priority questions. You have to practice diagrams, write beautiful diagrams, make your mind flow so that once you draw diagrams, you'll know how to write the theory. Okay. Practicals, you have to practice a lot. These are some things that you apply even in your clinicals, even till final year. This practical clinical examination is going to be very important. Buy proper books for them. Look at nice videos online and learn the clinical part. Okay. That is for passing the practical. Theory anyways you will manage, hopefully. Study well. Bye-bye.